That felt good. Wow.
Gentle. Sinking in.
Chiro cracks. Chiropractics for everyone.
How are we today?
Good.
Good. All right, so it's been a month since I saw you last. Let's do an update. How did you feel after I adjusted you last time?
Refreshed.
Good. We had some neck stuff going on up here. All right, we had some low back stuff going on here. We had some trigger point work to do out here. Okay, this is better. It's almost even, but still a little bit out here, right? I'm gonna lower this down so I can see your SI joints, okay?
Yeah.
All right, SI joint, right versus left, same, equal, tender.
I think right is worse.
Here, right equal tender.
They're both equally painful.
So let's turn to the right here like this. Good. Any restriction, discomfort, tension here. Let's compare that to here over this. Good. A little bit easier on one side than the other.
Yeah.
Going this way easier. Okay, right restriction for the thoracic lumbar transition. That's good. It's consistent as last time. Some soft tissue stuff to work on here. We're going to do an adjustment in the lumbar and the sacrum.
My ankles have been killing me. It feels like good when I crack, but it's like a painful crack, but like I have to. It feels like they get stuck. But it's probably because like I wear heels for work and I did fall down the stairs a few weeks ago. And my ankles got like stuck this way.
All right, anything else?
I think that's it.
All right, stand up nice and straight, nice and tall. So the pelvis looks very symmetrical, top to bottom, left to right, not a whole lot of torsion there. Yeah, I think we're gonna work on maybe like this right here, a little bit of sway back. Heel strike, flat foot, and toe off. It looks symmetrical and bilateral. I don't see any excessive eversion or inversion. Just a slight bit of inversion, and I think that that's been there for a while. As you can see, just the slightest little bit of a bunion formation, but that's bilateral and symmetrical. So I don't see anything different than or excessive or exacerbated in this case. Too many tension when I push here.
A little bit.
What here?
Mm-mm.
Here.
Yeah.
Breathing. Breathe.
Why does that hurt so bad?
This hurts so bad because your pelvis is tilted this way. And so all of these muscles are being elongated here. So what we need to do is just decrease this angle here by tilting you back this way.
Okay.
Pressure's okay?
Mm-hmm.
These strap fibers up here are like a map. They show us where on the spine we need to adjust.
They're actually not that bad.
Not bad. This is the one right here. This is the third trap fiber on the left. That tells us we need to adjust T4, 5, L1. Good, shoulders sinking in. Good, let it all go. Good, shoulders sinking in here. This is where you were the most ticklish too when I was running that machine. Okay, let your shoulders relax. There you go. Let's see if we diminish the trap fiber tenderness at all. It helped a little bit, right? It's still there. There's a tiny bit though, right? When you raise your shoulder up like that, you feel it, right?
Yeah. Breathe.
One more. Good. Oh yeah. Nice and gentle breathing. Good. We're gonna sink in here, letting everything go. Okay, let's just see if there's any more easy ones in there. Yep. Okay, let's see. I'm gonna push into this because I think there's one more. Is that still tender?
Yeah.
Very bottom S4. Okay, take a deep breath in. Out. Good. Shoulders sinking in. Good. Ooh. You feel a crack like right underneath my hand too. Okay, lay on your back. Just try to let it go. Let me do all the work here. Don't help me. Just let it go. Feel yourself sinking in.
Oh, wow. That felt good. Wow.
All right, you still have this crazy trigger point up here just a little bit. I can feel it in your occiput, like when I was doing this.
Yeah, that hurt.
That sucks, right?
Yeah, what is that?
It's just tension in a tendon from the trap. All right, so let's just like balance this for just a second. Take a deep breath into your nose. That was nice. Good job.
That was horrible.
Nice and gentle.
This one's hard for me to crack.
Yeah, it is more difficult on the right side. This is the ileocecal valve. This is the window between the large and the small intestine. We find it by first finding the belly button, which is right there, and then the ASIS. This is right here. Connecting these 2 points together is where we find the ileocecal valve. Nice, gentle belly breathing. Good. Okay, you're breathing.
Oh my god.
It's crazy that there's still stuff left to pop.
I know, my body doesn't stop popping.
Yeah. How's it feel?
Good.
Good. How's the neck feel? Move the neck around.
Feels good, not cracking.
Good.
Feels a lot looser, like I can move it more.
Push your elbow back right here. Harder. Kind of. Bend your knees. Okay, so this is how you fix the cracking too much. So right from here, you're gonna do a pelvic tilt. So you're just gonna tilt your pelvis this way. Yeah, but leave your back on the ground. There, feel that? Do it again.
Like doctor practice this every day?
Yeah, 25. So let's do this. Flip over so you're on your hands and knees. Have you ever done this before?
Is it like the, is it this? Wait.
Yeah, let's say, yeah.
That in yoga?
Yeah, but go the other way. Go the other way. Give me the cat. Right, so you're gonna cat it like that, like super cat. You wanna do like 3 cat per 1 cow. And maybe not even go into a full cow, like come down to neutral. Yeah, don't even, just stay right there. Now go back up into cat. Perfect. And you really wanna focus on like really tipping your tailbone down this way. Relaxed. Then you're back.
Whoa. I actually like always am constantly trying to crack my back and my neck.
Mm-hmm. Can you do it successfully?
I think. Maybe probably not as good as you.
Okay. Yeah, you know, it's easier for someone else to do it for sure. Most of the time. All right, so why do you want to crack your back and your neck?
Honestly, I feel like a lot of the time I get like pinched nerves that give me headaches.
Okay.
So like that release.
So the neck is the primary.
Neck, I always like go to crack like, I don't know, probably at the top of my vertebrae.
Okay.
I always like push on my head on both sides to try to crack it.
Up here. In
It
between.
cracks like, yeah, between my shoulder blades, but I always like push up to crack it myself.
All right, how often do you get headaches? Is that like a once a week thing? Once a month?
Okay, I used to have like really bad, in high school I got a lot of bad concussions. So that's when I started going to a chiropractor because of the pinched nerves, like in here from what I heard. I get them pretty often, honestly.
Okay. Every day?
Probably
Not quite.
every other day,
Every other
depending
day.
on like with sleep or like caffeine or how I slept on my neck.
Do you ever get any pain that goes down your arms? Any numbness or tingling in your hands?
Mm-mm.
Okay, that's good. When you get headaches, do you get nausea with it?
Yeah,
Blurred vision at all?
not blurred vision, nausea
Alright.
though.
So let's go back. So what was going on in high school? Were you like a stunt flyer?
Cheerleader.
Cheerleader?
Yeah.
So they were throwing you up in the air.
I was actually throwing someone else up, and then they came down too quick, and we like smacked head this way, like from the front, so it like knocked me out. Then like when I was knocked out, I fell back this way and like smacked the back of my head. So it was like front, back, and then I kept like accidentally bumping my head on stuff.
Yeah, once you get one concussion, you're more susceptible to more with less force. Yeah, I was practicing gymnastics with my daughter yesterday, and we did the same thing where we just came in, we bumped our heads, I had this big mark on my head. This is all the universe, like, winking at us, like, saying, like, you're in the right place right now. All right, so, okay, let's go back to the spine stuff. Any low back stuff ever?
When I like lay on the ground, I always like put my legs over and turn to crack.
Okay, you get it both sides?
Yeah.
What about other forms of movement, like exercise?
I retain Britain, so I like to, like, I'm in an international, like, entertainment dance company, and I get scholarship for it. I was just at, like, dance camp for a month, and then I was traveling for 2 weeks on tour, so this is probably perfect. My ankles are terrible right now, like, actually really hurting. I
Right.
don't know why.
Both equally?
Both, like, bad. And my ankles actually never really hurt before until recently. I had an elbow surgery. Yeah.
Okay, first we start with a very gentle scan on the top of your spine. So, but you look pretty good, pretty straight up and down. Are your shoulders relaxed there? Dude, you're strong. Your trap muscles are strong. Okay, I'm gonna do a temperature exam with the back of my fingers and measure the heat from left to right. Okay, pretty symmetrical here, thoracic lumbar. This is okay. And then this right scapular area, this is where it starts to like warm up a little bit. And then it's pretty evenly distributed at the top, but it's definitely warmer on both sides. There's maybe like a little bit of a change in your curvature just from here to here. Mm-hmm. It's not like a scoliosis or anything like that. It's just a little bit flat right here. And this happens sometimes from like having your shoulders forward. All right, I'm gonna push into your spine a little bit harder, okay?
Okay.
Tender here.
One thing.
All right, let's do this. Turn to the left. I'm gonna push into your spine. Any tension, discomfort here?
Oh, a little bit there.
Okay, let's go to this side here. Good. This just feels like it's stuck right there. All right, that's good. This is like right at the bra strap line, which is pretty commonplace to adjust with women. This is the SI joint here. Any tenderness, tension here?
Yeah, that's kind of...
Tender? Not great? What about the right side?
The right one's worse.
S4, anything here? Not as bad?
Not as bad.
S4 left, anything here?
That one's worse.
Okay, lower left, upper right SI joint. Good, lumbar feels pretty good. This is the part that you crack. You've got this part cleared. Right about here, it starts to increase in tension, so I'm definitely gonna do a couple of adjustments from here. Very symmetrical pelvis. That's good, but you have some tenderness on the SI joint, so we'll watch your gait too. Okay, looking for rib humping here, no curvatures to the left or right. Okay, good, and stand up. There is a swinging kind of, it's like a figure 8.
Yeah.
It's cool. Okay, go back and go the other side. I think it has to do, let's see. So it's like the infinity sign.
Yeah, I don't know why I do that.
Go ahead and turn around the other way. I think it's because, like I said, the bone structure is very narrow, like in your spine, your central spine. So like your SI joint, your sacrum is very thin, very narrow. Mm-hmm. But then your hips do come out. So maybe it's just the ratio of like the thin sacrum here and then a wider hip out here. Any pain, discomfort here?
Yeah, a little bit on this side.
Okay, I'm going to push down onto your left hip again. Do you still have that pain there?
No.
Better?
Yeah.
Still good? I'm going to follow your breath down like this. You're good, that you're nice and relaxed. At the end of your breath, we'll give it a little push like that, okay? It's tight up here. I'm going to have to push just a little, tiny bit harder, okay?
I felt that.
Deep breath in, all the way in, far as you can go.
Oh. That was a deep one. Wow. That was intense.
Lean back as you blow it out. Good. Good shoulders, shoulders. Good. Good. Can you lay on your back? Good. Shoulders relaxed. There's more. Hold on. Lay on your back. Now to the left. Back to center. Okay, bring your left ear down to your shoulder. Okay, good. That's where you're restricted. Back to center. Now the right ear.
Whoa. That's quick.
That's pretty good. You didn't get all of it though. Deep. Good. Keep belly breathing. Breathe. Breathe. Keep breathing. We're almost there. You almost got it. You almost got it.
Oh God, what was that?
These are organ manipulations. Very good.
Holy. Oh, sorry. You're like a new person.
Pretty wild, right?
Yeah. I don't think nothing's ever cracked that much in my life.
Yeah, it's very sensitive.
Was it?
Don't make me laugh. I like felt that one like all the way down. Oh, that's weird. Drive a lot, so I try to like remind myself to stay upright.
Good.
But it hurts.
Pinchy feeling, is that present every day?
2 to 4 times a week.
How often do you see a chiropractor now?
Like twice a week.
That's a lot. How long have you been going twice a week for?
Like the past couple of months. Yeah, I try to stretch every day, sometimes twice a day. You know, every once in a while I'll get those days where I don't do much, but then I hurt, so I'm like, oh yeah, I need to do this.
Have you ever tried PT?
Professional physical therapy? No.
Do you ever have to take any medicine for the upper back?
Now, no. When I was growing, I had really bad growing pains, so I took a lot of medicine then because it was really painful.
It's been there for a while. It's pretty frequent. And how bad does it get? 10's the worst pain ever.
Maybe a 5 or 6. I don't think I've ever gotten it like, not since I've stopped growing. It hasn't been like, that was like max.
Yeah.
That was a 10 then.
Any other major accidents, injuries?
I know like when I was little, I had like a cyst in my neck that they had to like drain because it was really big.
Did your chiropractor take x-rays of you?
Yeah. I know the way your neck is supposed to curve. Mine curves backwards. Mine's literally the perfect C shape opposite direction. And then my spine, the lower area was very obviously like major scoliosis curve.
Most likely, this is what the literature, the scientific literature suggests, that the curvature in your lower spine and the pain in your upper back are all going to be a result of that loss of your cervical lordosis. So that is the primary thing to work on, which is better to work on at home every day. So I'll show you how you can do that. In the meantime, I'll adjust everything else in your spine that needs to be adjusted and then figure out what's the best way for you to like continue to grow in alignment. That way you don't have to go to the chiropractor twice a week. That's too much. Looking at the feet, heel strike, mid stance, and toe off. There's just a little bit of eversion, but it's bilateral and symmetrical, which suggests that it's normal. Looking at the feet coming back this way, much more straight away. I don't see any pronation, supination. I don't suspect any loss of arches, but we'll have to get under there to see. All right, looking at the hip height, we most likely have a higher left hip by this angle. We'll have to check that. Good, and then a high left shoulder as well. Let's see it on the way back. Okay, good. Yeah, I see high left hip, high left shoulder, high left mastoid process on the ear. Okay, so just a little bit of lean in that way, which means we would expect to see a curvature. All right, arches are definitely intact. Go ahead and turn around the other way. Good. Looking at the Achilles tendon, there's no bowing, no pronation, no supination there. Just observing the spine first. You can see the left hip starts to come up a little bit. And if I'm going to put my fingers on top of your hips, okay?
Okay.
We're going to be able to see that discrepancy. It's very apparent. You can see the tilting of the sacrum and the entire pelvis is going this way. The curvature follows suit in the thoracolumbar spine. It's curved. There's an apex convexity on the right. So here's our apex, and there's also a rotation because the musculature is more prominent on the right versus the left. Tone is like the amalgamation of all the layers. Bone, marrow, blood, nerve, muscle, ligament, fascia, skin. Every layer has an electromagnetic pulse. Can we do a temperature evaluation? The back of the hands. Good, very symmetrical, cool, no excessive dampness or dryness on the skin. It really becomes much more prominent in the upper thoracic once we get to the level of about T4, 3-4. Okay, I'm going to palpate the SI joints. Open, close, open, close. The right side is moving nicely. It's the left side which just lags a little bit. So we'll check the left SI. You're going to feel my fingertips on your hamstrings, okay? Okay, feet are even, then looking from the top. Good, we're accentuated on the right. So the right one is like lower and out. And so that means that the pelvis is rotated back and out like that. It is hypertonic on this right side. This right glute is hypertonic. I'm going to check the movement of the sacrum versus the ilium. Okay, go ahead and bend forward. Come back up. Good night. So there is movement there. Let's check the right. Okay, go ahead. Right side. Saw the compensation there in the curvature as you were leaning. One more time, bend forward. All right, let your head relax. Okay, nice, smooth, long curve in the thoracic spine from the thoracic lumbar transition all the way up. There's not a lot of rib humping, which means the rotation is minimal. I don't expect a hypermobility issue with you. That's fantastic. So whatever cracking you're doing is most likely healthy and safe. And as long as you're doing it consciously, drinking lots of water, stretching, yeah. All right, so I'm going to follow the sacrum down here to the coccyx, right? Do we have any tenderness here?
Yeah.
How about here?
Yeah, I'd say about equal.
Then there's corresponding segments in the occiput. So we just find this segment in the occiput that has this similar type of tension. Yours is right there. Is that a little tension? A little tense?
Yeah.
Okay, now we'll recheck. Is it still tender or is it the same, better or worse?
I'd say probably better. That's tender.
This one's still tender, right? Okay, let's give it a try. Deep breath. Good. Sinking out the back. Sink. Very nice. We're going to check the contraction of the lumbar muscle. So I'm going to lift your right leg up in the air.
Like that?
Exactly. Down. Okay, left. Good, down. Can do the right again? Okay, down. About even in height. Was either one more difficult for you? Try it again, do the right. Down. Left. Down.
Maybe the left.
So when you lift the left leg up, the right lumbar paraspinal musculature contracted perfectly. So it means we have no issue on the right. Good, well, nice and straight up and down that way. Okay, deep breath in. And out. This one's like this, forward. So I'm gonna pull it back this way, and it's also external, so I'm gonna push it back that way with my hip right here, okay?
Okay.
Nice. And your back. Nice gentle breathing. All right, nice and gentle breathing. We're gonna start on the right side first, okay? Nice and gentle. I'm gonna bring your head over to the side, like there. Very gently. We're gonna follow your breath, just like the other adjustments.
I like felt that one like all the way down.
Gentle, gentle.
Ow.
All right, ready? Hold your knees together now. Hold them together. Don't let me pull it apart. Hold it. Hold.
Oh, that's weird. I didn't expect, like, I was like right in here somewhere pop.
All right, so this is a digestive organ manipulation, okay?
Okay.
It starts with the ileocecal valve. This is the window between the large and the small intestine. We locate it by first finding the belly button. Yours is here.
Okay.
ASIS, the front of your hip bone, okay? You can do this too. All right, so we connect these 2 points. In the middle is where we start looking for the ileocecal valve. Tender.
A little bit.
Nice, gentle. Can your belly breathe? Keep breathing into your belly. Okay, we're just going to follow the diaphragm along, release any tension.
Yeah, right on there is a little uncomfy. Because that's where it hurts when I normally get adjusted and people push on my back. It's like right in there.
I think it's your ribs. Can I see your tongue? All right, put it away. All right, so do you know what's about to happen? Did you watch any of these adjustments?
Not really.
All you have to do is keep your teeth together. As you breathe out, we'll follow your breath like this. And at the end of your breath, we're going to go in that direction, okay?
Okay.
Just like the other adjustments, you'll only feel it for a little bit, and then it'll feel better afterwards, okay?
Okay. Oh, God.
Keep breathing.
Okay.
Breathe. Breathe through your nose.
Mm-hmm. There's so many feelings that my body doesn't even know what to focus on.
That's good. That's good awareness. Yeah. Just keep breathing.
What are they called? Your little pieces of your spine?
Vertebrae.
Vertebrae. In my brain, I feel like I just saw them all kind of like separate. I think my body was just very like
In shock.
overstimulated.
Walk
I
around
feel
a
like
little.
shaky almost. I feel weird. It's like loose, like a weird loose. I guess it's not a bad thing. I just don't think I'm ever this loose.
Push. Push.
Oh. It's always hurt, and then if I open, it gets stuck.
Open. Okay, close. Right there. Breathe. You need to do this at home.
Oh, God.
If your jaw doesn't feel good. You just follow the line of your teeth back.
Uh-huh.
The first thing that you hit. Right? It's okay. This is the worst I've ever felt.
It's very sensitive.
Was it?
Don't make me laugh. It hurts. Okay.
Okay, look, it's getting better. Hold on. See how my fingers going a little bit further in?
Mm-hmm.
Because the muscle's releasing.
Oh, fuck.
Okay, you're doing good. Just keep breathing. Breathe. Good. In through your nose. Go. Out.
That was the nicest thing anyone ever did for me.
You were diagnosed with chronic fatigue, or
Chronic anxiety and depression and sleep insomnia.
and it really came down to you were
severely dehydrated. I couldn't go to sleep when I wanted to sleep because of how dehydrated I was. Like, no appetite, like didn't even want to eat food. I wasn't going outside, I wasn't being active, I wasn't eating. And I did have to go to a chiropractor like a year ago. I saw one. I started having like pain every time I'd like step on this leg, like up and into my back.
Ever have any back pain or neck pain?
I get neck pain like here a lot. My head gets really sore, and then my lower back.
Okay, looking at the feet first, there's an inversion on the right. Flat foot is really where you see supination / inversion on the left. There's definitely a dive into the right hip. So when we're standing on the left foot, the right hip is diving out. Your body built more bone on top of that part of your foot because of the way that your foot turns in. You do have just a slight exaggeration of this curve right here. Okay, looking at your shoulders though, you definitely have a high left shoulder here. But other than that, everything looks very straight up and down, very symmetrical. Let's do a temperature examination now with the back of the hands. This is more sensitive to temperature changes. It's very consistent. Your muscles are working harder here. But then when we get up to your shoulders, this is just on fire.
Yeah.
Okay, I'm going to push a little bit deeper into the muscles.
Very tense.
Yeah, there's a little bit of edema. Is that tender?
Mm-hmm.
What about this one over here? Is this one tender?
No.
Okay, tracing up to the bottom of the glute folds. We're lower on the right side here. That means your right hip is back like this, or your left hip is forward. And a little bit of back and forth, right and left. Not too much front to back though. Okay, left, down. Your right lumbar is not firing correctly. Right and left, does that still feel the same?
Actually, it feels better.
Okay, let's work on this trap fiber a little bit. This is on the right side, so we'll see what happens when we get to the left. Nice, gentle breathing.
Yeah, that's like a pressure point. It hurts.
Gentle breathing. Very subtle stretch here of the spine. I'm going to follow your breath down like this, and then when we get to the end of your breath, we're going to push like that, okay?
Mm-hmm.
Good sinking in. Following the breath just like the other one, all the way down to the shoulders sink in.
Oh.
Good. Following it down. Okay, nice and gentle breathing. We're going to take a deep breath in. Good, and out. We're going to bring the hip down and the shoulder up. Very good. A little bit more. Hips down like this. This is the hip that's gone forward, so we're going to push this back in that direction. Okay, go and take a deep breath in and out. Nice, gentle breathing. I'm going to bring your head over to the side like this, and then we're going to push it in that direction like that, okay?
Okay.
Follow the breath out.
It's crazy what that feels like. It's crazy like the sensation you get afterwards.
Okay, nice and gentle. Good.
Oh my god.
All right, so first we start with the ileocecal valve. This is where your small intestine empties into your large intestine.
Okay.
You locate it first by finding the belly button. Yours is there. And then your ASIS, top front of your hip is here. Follow these 2 points, connect them. That's where we start looking for the valve. It should be a little bit tender. Yours feels like it's full and active right now. So it's a little tender right there. Now breathe in and push your belly out at the same time. There you go. This is belly breathing or diaphragmatic breathing. Do it again. This is how you breathe when you're relaxed. Stress causes you to chest breathe and use all these muscles up here, which you're not supposed to use unless you're running. That's good. Okay, so this is a full spine adjustment, okay? Nice gentle breathing. As you breathe out, just like the other adjustments, I'm gonna follow your breath and then we're gonna pull in this direction.
Oh my god. I was not expecting that. Oh my gosh. People normally cry after that.
Yeah.
That's like such relief. That was the nicest thing anyone ever did for me. It like really hurt and it felt really good at the same time. I feel like it's so even. You like don't realize how much weight you're putting on one side. I feel like I could be really balanced. Yeah.
Good. Right side push.
This one's freaked me out. I'm like still overcoming from that whole like whatever the heck that thing was you just did earlier. Oh my god.
Insane. It was amazing. I do get neck pain sometimes.
Okay.
And like it feels stiff.
How long does it last? Is it like a day or two of it? Does it go longer than that? Or
Like 2 days. Yeah. Might be like a sleeping thing.
no one's really looked into this before ever. Do you ever get any headaches?
Yes.
All right, where on your head does it hurt?
Like back here. It's kind of like inside.
Do you ever have to like go lay down and sleep?
Yes.
Have you ever been to a chiropractor before?
No, never.
All right, looking at the feet first. You have a little bit of, it's called a hallux valgus there. All right, I don't see any external or internal rotation. Okay, a little bit of a left head tilt towards a high shoulder on the left as well. Definitely a high left shoulder. All right, put your hands on top of your hips like this. Okay, I'm gonna replace your hands with my fingers, okay? Got it, let that drop. Okay, high left hip. There's a lot of increased tone here. You're right-handed? I'm gonna do a temperature evaluation of the back of my fingers. The back of the fingers are more sensitive to temperature. No deviations from the right to left. Okay, I'm gonna dig a little bit deeper into the spine. Any tenderness here? Compare it. Does this feel like this?
Like
Same?
it's kind of tingly on the left.
Okay, nice and balancing in the low back. Don't feel any restrictions there. You just have a slight rotation in your spine. There's more muscular prominence here on the right side in the shoulder blade area. And that's okay. No one's spine is perfect.
Okay.
Like, what's this guy right here? What is that, huh? All right, so tracing up to the bottom of the glute fold, it's lower on the right. So that means the right hip is going back like this a little bit. Okay, then looking from the top, the right one comes out a little bit further, so that means it's externally rotated. There is no curvatures of the spine. Spine tells a slightly different story when you're laying down, so we're gonna palpate the spine in this position, okay?
Okay.
Nice, gentle breathing. Tender? 4, 5, 6, T6. This guy too here, right? Which one more?
The lower one.
Yeah. This one right here, right? We're on T1. Yeah, so this is muscle stuff here. not really a trigger point so much. More on the left, right?
Yeah.
This is postural. This is you hanging your head forward. What do you do for a living?
I work in an emotional support classroom, so.
No, that's one of the most difficult jobs there is. No wonder you have stress. You definitely have a high pain tolerance.
Yeah.
Because this should suck. Okay, ready? Okay, now you turn your head to the right.
Oof.
Turn. I'm going to put some magnesium on top of this. Better than before?
It does feel better.
Okay. That's coming from the spine. Blocks underneath of your hips here. Yes, good. Down. Then relax. Nice, gentle breathing. Nice and gentle, practicing. Go and take a deep breath in. I'm not pushing yet. I'm just going to show you what it feels like, and then out. Okay, and then I'm going to follow your breath out like this. Nice and gentle. Go and take a deep breath in. Let's sink in. Good, letting it all go. Go let this all sink.
That felt good.
Okay, let's give it a try. Go and take a deep breath in, far as you can go. Good. Now let your shoulders relax as you breathe it out. Let it go. Good, letting this go here. Good, sinking in, shoulders relaxing. Good. Good, hold on, there's one more though. Let this relax here. Good. Right, deep breath in and out. Good, shoulders coming up. There's more, hold on. Crack your own back, let me see.
Oh, really?
Yeah, I'll see if there's anything left.
Okay. Like, is anything? No, nothing.
Good, back to center. Now turn your head to the left. Back to center. Nice, gentle breathing. Feel the air coming into your face. Gentle.
Oh my god.
Let the shoulders go.
Ooh. It feels so good.
Okay, you're gonna squeeze my fist again? Squeeze? Was that it?
I think so.
There. Then your ASIS, the front of your hip is here. We connect these 2 points. In the middle is where we start looking for the ileocecal valve. Yours is here. It's tender, isn't it?
Yeah.
I'm gonna do a circle in this motion. See if we can help it relax. So you know how to belly breathe?
I think so.
Okay, so you're gonna take a deep belly breath. Good, and out. There we go. Okay, let's give it a try. Deep breath in and out. Good.
Oh my god.
Yeah.
That was crazy.
Yeah. Huge release in your neck, right?
Oh my god, yeah.
How's it
I feel
feel?
like so much lighter. I feel like loose. Feels great. Insane. It was amazing. Oh.
How's your spine today?
My lower back is usually like, I just typically feel a little twisted.
I adjusted you a month ago. How'd you feel after I adjusted you?
Great. I swear that I must twist myself up when I sleep. Laying on my side, maybe?
Good. Any tenderness here?
No,
Here?
a little.
That guy there?
Yeah, and there.
Anything new in the last, any injuries, incidents, anything to report?
Nope, so just trying to use stretching and yoga to sort of self-adjust.
What did you say about your shoulder getting hit?
It started in my upper back, about where you're touching, but the incident was that on a jet ski, I was kind of holding the handlebars, right, and it jerked it, I think, out of socket maybe, and then I could move it, and I said, I've never broken a bone, so I've never had that sensation of not being able to move something. So I fell off the said jet ski and it turned off, and then I couldn't move one arm, and I'm in the Susquehanna River, sort of flailing, trying to have I fell off with someone else, so they're holding on to me, and I've got one arm working. I'm like, dude, I can't move my arm. I don't know what happened. And eventually, I don't know if it was me, just the mental trying to move it, that got it to kind of stick back in, but I had pain. I had pain for months. Couldn't really move it well.
Tender.
Mm-hmm. Oh my goodness. Part of the pain for sure. I can definitely feel the tenderness.
So you're breathing.
I love magnesium. I feel move on that one.
Are you ready to get adjusted? Okay, nice gentle breath here, Lucy. Okay, Lucy, this one's a little bit different. This time you're going to take a deep breath in all the way in. Good, and then as you breathe out, we'll push on the top of the breath. Good, do that again. Let the shoulders sink as you breathe out. Now you're back. Good, shoulders coming up. Good, good. Good, one more time. Let the hip go, shoulders go. Good, then you're back. I'm going to adjust your left side.
It's like night and day.
What?
It's like night and day. But I can move my neck again. Have you done that float spa?
Yeah, absolutely.
They've got me a gift card, and I never did use it. And I've been
my God, you
really
need to go
thinking.
do it. All right, nice and gentle here at the bottom. We'll just do a very gentle one.
Oh.
Is your jaw okay?
It feels great. I was just like, my jaw felt not so great, and now it feels better. Like I actually felt like.
Now open slowly.
Oh.
Okay, open your jaw, like halfway, but like let this loosey-goosey here. Good.
Oh, it doesn't pop anymore.
Open. Open halfway. Go, let this relax, let this like loosey-goosey. I couldn't stop laughing at that time because you were doing.
Oh my gosh, my jaw.
All right, let's do this. Go and squeeze my fist in between your knees. Push, 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 push. Relax. Okay, now squeeze again. Squeeze. Okay, relax. Okay, squeeze your knees together again. Squeeze them together. Hold. First, I'm going to find your belly button here. This is your ASIS, the front of your hip bone here. We connect these 2 points here. And again, in and out.
Oh my God. Now I can really breathe. Oh, wow. That was amazing. Everything feels different.
Good, almost there. Hold on. Good, one more time. Good, push.
Oh.
Kelly, your arm rests on my shoulder. Go take a deep breath in. Out. One more way down. Good. Shoulder relax. One more.
Oh, it doesn't hurt down to my elbow anymore.
All right. That was beautiful.
Thank you.
Yeah.
I feel like a new person. I'm gonna go swimming and just feel like this fluid person. Oh yeah. If I can't bend over and kind of get anything out of my back like that, then I am.
Adjusted.
Yes. I'm even going farther in my forward fold.
What happens if you straighten your knees? Wow. Good adjustment.
Yeah, definitely. But yeah, I'm definitely that.
So good.
That one's so much farther. Oh yeah. Even my wrist feels better. I know that there's just one little thing.
Okay. Well, give me an update. How do you feel?
I'm super sore. Mostly my legs and my shoulders.
Okay, but that's workout stuff.
Mm-hmm.
All right. Have you had any back pain or neck pain recently?
Not recently, but like a couple months ago, I pinched a nerve real hard.
Where at?
In my lower back.
Did you get pain down your legs?
Yeah.
Numbness and tingling?
It was rough. I could not turn either side.
How long ago was this? Is it a couple months?
Yeah, a couple months ago.
How far down your leg did the pain go? Did it go past your knee?
No, it was pretty much just through the hamstrings.
Both sides equal or one more than the other?
Not pretty equal.
Pretty good here. Very strong. Have you been working out in the gym too?
Mm-hmm.
Your tenderness here? Here? Is that tender? Huh?
Mm-hmm.
That one too?
Yeah.
Yeah, this L4, L5, both of these are stuck and not quite as bouncy. All right, so we'll focus down in here and make sure that we adjust this. Any neck pain, headaches?
Yeah.
Both?
Mm-hmm.
Left or right?
Left.
When you had the pinched nerve, which leg did it go down? One side or both?
I think it was both. Oh.
Tender?
Mm-hmm.
So this is just glute soreness here. That's fine. If we adjust the SI joint on that side, that'll help a lot. Also, you're supposed to be sore after you work out. Left hip up. Good. Down. This time I'm going to push at the top of the breath, like somewhere around there. Let's do that again. Deep breath in. And let your shoulders sink as you breathe out. Oh. Okay, I'm going to remove the blocks. Okay, deep breath in. Okay, nice and gentle breathing. Good, shoulders coming up this way. I'm going to bring the hips down. Good, deep breath in. And your back. Okay, turn your head to the right. Center. Left. Center. Bring your right ear down to your shoulder. Center. Left ear. Center. Nice and gentle. Just trying to do some traction, start loosening up your. Just try to let your head completely relax into the table. Nice gentle breathing. As you breathe out, we're going to push in that way like that. Good. Sinking in. Go do another breath. Good. Okay, gentle, 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 gentle. Good. Okay, now push your knees out to the side. Push, 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 push. Good. Squeeze my fist again. Relax. Nice. Okay, I'm gonna start with the ileocecal valve. Okay, so first I'm gonna place one hand on the belly button, okay? Then the ASIS here at the front of the hip bone. We're gonna connect these 2 points, start looking for the valve from there. Any tenderness there? That's very good. Okay, the pyloric sphincter. Okay, now I'm going to do some diaphragm manipulations. Nice, gentle breathing into your belly. How's that feel? That tender?
Yeah.
This is where all these noises are coming from, right here.
Really?
Yeah.
Mm-hmm.
Think we got them all?
Mm.
Do you crack your fingers or what? Never seen this.
Mm-mm.
Okay, I'm gonna pull this and make sure you're tight. Okay, bring your hands to your belly. Alright, so this is a full spinal adjustment. Okay, I'm gonna use this towel to support your neck, okay?
Mm-hmm.
So just like the other adjustments, I follow your breath. As you breathe out, I'm gonna use the towel to move in this direction like that. So we're gonna pull there, okay? Okay, deep breath in. Good, and out.
Oh my god.
Pretty awesome, right?
Yeah. like, we haven't gotten as many cracks this time. That was the one.
Where did it crack?
Everywhere. Oh man. I'm always sore. My neck and shoulders a lot.
You wake up in the morning, neck stiffness.
Yeah, I work out and I model and I work in a salon, so like everything I'm doing is kind of like hard on my body.
Okay, looking at the feet first, we definitely have some pronation on the left. The arm swing looks normal and symmetrical, but hip swing looks like we have higher on the left. We have more upward movement on the left. Yeah, you're definitely working a lot harder up in your shoulder area. And as soon as we cross the bra line, it's where it starts to heat up. Right or left, which is more tender?
Right, for sure. Yeah.
Now look at your glute folds. You're going to feel my fingertips on the back of your hamstrings, okay?
Okay.
Okay, tracing up from the hamstrings to the glute fold, we are lower on the right. When I was watching you walk, I did say that the left hip was higher. Looking for curvatures, there's no sign of rib humping here, very symmetrical. I can see almost every spinous process, which is really cool. I'm gonna watch your postural sway, very small micro movements. The right leg is short, so that confirms the glute standing test. Here, do you have any tension, discomfort right here?
Little.
Here.
Oh, right there's more. Yep.
Okay, do you feel it more on the left or the right?
Both actually. Depends. Oh, right now. Yeah.
This right
Yep,
here.
right there.
There was a slight prominence here on the left lumbar musculature. And then the tenderness at this transverse process here at C3 tells me that the L3 transverse process has gone anteriorly, rotated that way. Oops. Good. Here, don't help me. Let me do it. Terrible, huh?
Yep.
Terrible there or what?
Kind of feels good. It's like a good pain.
Shoulders relaxed, just sinking in. Good. Okay, nice deep breath in and out.
I felt it.
It's a little bit different. This time you're going to take a deep breath in, and then at the top of the breath, as you breathe out, that's when we push. Good. Deep breath in and out. Good. Now let it relax a little bit. Let it go. Let your back go. Oh. Nice and gentle breathing, just like the other ones. Just like the other ones, I'm going to stretch your shoulder up like this. As you breathe out, I'm going to bring your hip down like this. We're going to push like that, okay? Good. Let the shoulder go. Good. We're going to bring the hip down just a little bit. Let it go. Let this relax. There you go. That's good right there. Good. Just sinking in, letting the hips sink. Good.
Oh! That was a good one.
Yeah. Good. Gentle breathing. Good, we're going to bring your hip down. Good, shoulders relaxed. Good, hips relaxed. Good. Good, one more. What do you feel here more, Shay, right or left?
My left, I think. Yep. Yep, right there.
When you got into that car accident, was your head turned when you got hit from behind?
I think so. I was talking to my boyfriend.
You have a rotation in your cervical spine, and so that's why this SCM is constantly contracted over here. I'm going to test this side first. Let your head relax, shoulders relax. Okay, we're going to see 7, so like that needs to be moved. Really let this go. Let the shoulders sink in. Good, letting it all sink, sink, sink. Let your head drop into the table.
Whoa. I thought that was a lot.
Let your head drop into the table. Good. Good, right there. Good, let this relax, loosey-goosey. Another soft breath in and out. Okay, I'm gonna crack your toes. Go let this relax here.
Whoa.
One more, it's right there, Shay. And the valve can be found, first you find the belly button here, and then the ASIS here. You connect these 2 points, that's where you start looking for the valve. Yours is definitely active right now. Huh. So now it's much softer, right?
Yeah.
That was one of the best ileocecal valves ever.
Really?
Deep belly breath.
Like push my belly out?
Yeah, when you, yes, now pull your belly in. Perfect, keep going in. And out. One more.
Is this the towel adjustment thing?
Yeah.
Where you pull up? I've had this before. Not in this thing though.
Oh no, yeah. There's only 10 chiropractors in the world who have this table. Okay, so the pins keep your hips in place. You can unfold your legs, please. And then the towel is going to be used to support your neck. As you breathe out, we're going to pull in this direction like that, okay?
Okay.
Good.
My neck feels a lot more mobile.
Mm-hmm.
I feel like I can, my walk isn't so stiff.
You're good.
Whoa.
Just put your hand out in front of you. Put your thumb pointed down. Good, now raise your arm up slowly. Do you feel any of that pinching?
No.
Okay, bring your arm out to the side here. Push up against my hand. Do you feel any of that pinching?
Yep.
Okay, let this relax. And then it's tender here.
Mm-hmm.
Okay, so
Oh, right there. Yep.
right here.
Yep.
So your shoulders coming up like this. Okay, let's bring this up here. There it is. Did you feel it?
Yeah. Oh, there it is again. Oh, man.